Thank you so much for being here today. I know that the discussion on mental health can be a draining one. So just a reminder for everyone to take care of themselves as we carry on speaking through this. And thank you so much, Joy and Heather, for setting this conversation up so perfectly for me. To start by talking about mental health stigma in Africa. So before we begin, obviously you can see I'm white, and so as a white South African, I want to begin by recognizing my own position and intersections. So I cannot pretend to fully understand the lived experiences of survivors of stigma or the depth of Afrocentric approaches to health, to mental health. But what I can do is I can be here with you all. I can listen, I can learn, and then I can pass this knowledge forward and transmit the knowledge I have learned and have been entrusted with to all of you. And a lot of you are already experts in this field. So this is sure to ensure that the voices and the wisdom of those that are at the center are carried forward with respect. So let's start by asking everyone here today a question. It doesn't matter where you're from or anything. What have you ever felt like you couldn't talk about what you were going through? It's a very from childhood all the way here. Is there ever been a time that you haven't been able to talk about something you've been going through? So you can put the answer in the chat or write it down if you don't feel comfortable. I'll give you a couple minutes. Okay, let me see if I can access this chat. Yeah. Let's see. We're getting some yeses in the chat. And I'm not going to put anyone at the spotlight, but I think that not being able to speak about things is a universal experience, no matter where you're from. And I think it all ties back to stigma. So what is stigma? Stigma is a concept that involves the shame, silence, and discrimination. So feeling like you're not able to say something because you are afraid of feeling shame or because you feel silenced and you do not want to be discriminated against. It has 3 different levels. So the first being self-stigma, which involves how we see ourselves. In mental health in particular, say you have depression, not being able to address this and say, or fully internalize it, I'm depressed, I have depression, or I have anxiety, is how we view ourselves. So this self-stigma and feeling shameful or silenced because within yourself. So that is an individual experience, which is often external because all of these levels of stigma are interconnected. So we might feel self-stigma because of social stigma, which involves how others treat us. In Africa in particular, say someone has a mental health disability or a mental health disorder like depression, anxiety, bipolar, PTSD, they're afraid to say something, perhaps, in their community because they don't want to feel the shame or feel dismissed. So that is social stigma, the norms around a certain concept. And finally, there is structural stigma, which is a little more complex, but it's how systems and institutions respond to different stigmas. So this can be discrimination laws, restrictive policies for people with mental health, and institutional practices that create inequitable care, like underfunding mental health research, lower staff for mental health, or lower quality of treatment. So combining all these things, we don't need to put money towards this because people don't need it. It's structural stigma. It's against something that is stigmatized. It's also important to note that stigma is a global concept. It's not tied to Africa, and there can be stigma for anything anywhere. Joy mentioned this earlier. For instance, boys don't cry. That's a sentence that is stigmatizing for men, and that's often a global experience. At the same time, maybe this is not the truth for Africa. I also recognize that stigma is not the reality everywhere in Africa. But talking about the darkest the darkest parts, I think, remain important because we can confront them honestly and we can see how we can grow from them and how healing is possible together. And through being all here together is just an example. So let's watch this video. It is from Kenya, and it's talking about collective stigma and how that is a barrier to mental health care.
A wave of protests hit Kenya these past months as anger.
We can hear it, Joy.
Oh, you can hear it?
Mm-hmm.
I thought you weren't hearing it. I think
No, we could hear it.
A wave of protests hit Kenya these past months as anger over tax hikes and the cost of living spilled into the streets. Anger, frustration and fear, all having a deep impact on people's lives.
So some of the main causes that we have noted to have maybe contributed to mental health conditions or issues, we can talk of economic hardships right now in the country. So many people are trying so hard to, let's say, make a living, and in these times depression kicks in and people don't have the control over their mental health. The sleeplessness, I haven't slept for like 3 days now.
But for many like Joyce Mugure, who struggled for many years with bipolar disorder, it takes time to find the courage to ask for help.
I didn't know what I was going through. So all my life I've been feeling different. I've faced a lot of stigma and discrimination because most people around me didn't understand what I was going through. Nobody knew it was an illness. Until one day when I was very suicidal, I saw someone advocating for mental health online, and I reached out to them.
The Psychiatric Disability Organization in Kenya estimates around 2 million people are living with mental health issues. The organization offers therapy sessions at moderate rates with services for people who can't afford the payments. If not handled, mental health issues can have devastating consequences. The World Health Organization estimates that Africa has the world's highest rates of suicide in the world. Breaking down taboos around admitting to suffering psychological distress is key to bringing the numbers down. Gladys Mwiti is a psychologist. She shares her recipe for good mental health.
Do not take it for granted when you are finding you cannot sleep, because insomnia is related to stress, and the stress then will lead you to depression. So make sure you sleep well, exercise, eat well, and then get support around yourself. Make sure you have 1 or 2 friends that you can run to at any time of night or day.
So although it's short and it doesn't cover everything, but I think this video is a testament to the crisis that there is in Africa, the mental health crisis. And it all stems from not just barriers to healthcare, but from fear. So stigma and fear are two things that are incredibly tied. Mental health is obviously something that it can be scary because it's the unknown. So by having these conversations, by talking about stigma, can start breaking this wall down and allow people to access care. But right now, survivors and stigma are two things that also have gone hand in hand. So we're obviously in a place full of experts, and I can imagine that fear of accessing health is one of the greatest barriers. And in fact, 10%, only 10%, we had this question at the beginning of this class, but only 10% of survivors of human trafficking have ever accessed mental health services, which is incredibly low and incredibly unfair and unjust, considering that mental health is a right. So why is this? And it's largely because they fear, or people fear, accessing this care because of shame and silence, and it makes it impossible to seek help, or afraid to seek help. So what are the effects of this? So it will touch on families, clinics, and survivors' sense of self. And so beyond So here are a couple reasons of why stigma has been built up in Africa in particular. For one, Joy also mentioned this, the beliefs that if you have are experiencing some mental health disorder, is because of witchcraft, spiritual imbalance, and it's a form of punishment. Also barriers to health. So there's few services, so the less we know about it, the less open people will be to accessing care. There's a lack of providers, it's expensive, and then there's also gendered stigma behind it. So on one hand, women are silenced and blamed about their mental health, and then male survivors are denied access to care because they have to be strong and they cannot cry. And these are two things which eventually is a self-fulfilling negative cycle, because survivors will keep silent and pain becomes bottled. Obviously, here today, we have so many survivors that are speaking up and against stigma, and this is first conversation, an important conversation to breaking down these cultural norms. Which also, another impact of stigma is the delayed access to care, and then deepening this shame and guilt and isolation. And then communities will lose their voice of healing and resilience. So by cutting down this error right in the middle, talking about it, that is one of the main solutions to stigma, and to break this cycle of 10%. We need to change this 10%. And so thank you for all being here and changing this 10% by just speaking about it, by just talking about stigma, by talking about discrimination, the feelings we feel, the silence, the blame, is a solution towards ending it and accessing care and changing this 10%. So I'm going to finish off this section with a quote from a survivor that says, "If you show weakness, people pull away. They avoid you. So I stayed silent for years until I met other survivors who understood without judging. That changed everything. These judgment-free, safe spaces are what changes people from being silent to being loud. And by doing that, again, not just stigma, but changes and ends horrible crimes." So thank you so much for listening and for the first section.